Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate as of April 27th, 2023. Now, normally for the last update of each month, I do an update on COVID and other infectious diseases, but this week there's a more pressing issue for me, and that is, why should we worry about the threats to the scientific independence of the Food and Drug Administration? Now, in terms of disclosure, I worked at the FDA for almost 11 years, but I care deeply about the process and the product that they produce. Now, some of you will recall that we reviewed the drug approval process in early 2020, because at the time we were looking forward to knowing what it would take to get a vaccine approved. And just as a quick reminder, before any human trials start, the drug has to be tested and shown that it can produce it effectively. It has animal testing and so on. Then they submit something to the FDA. Manufacturers submit something called investigational new drug application, an IND, that lays out the information that they have on safety, the reason they believe it might work in people, manufacturing issues, and so on. If the IND is granted, then they begin what they call a new drug application, an NDA, which typically, though not always, has three phases. Right? Phase one is small numbers of healthy people who are exposed to the drug to see how it's absorbed and any toxic effects, hopefully not any. Then phase two is a larger number, but still a small number of people with the disease in question, trying to figure out, does the drug work? Does it have unreasonable side effects? What's the dose? And so on. If that all works, then they go into a phase three trial, which is often thousands of patients to really get a sense of both safety and effectiveness. And then once the drug is approved, manufacturers are required to do post-marketing monitoring. One thing I didn't put on this slide in June of 2020 was that they also have to have their facility manufactured so that there's a sense that it complies with good manufacturing practices. So that was reviewed in June of 20. And then earlier, a few months ago, I looked at the question of political intervention. And at the time, I stressed that this isn't about any one administration or any situation where people disagree. It's simply about situations which political considerations preclude, interrupt, or replace the scientific process. So now what I want to do is take those two ideas, what is the drug approval process and what is potential interference with that, and ask the question, why should we be worried about threats to the scientific independence of the Food and Drug Administration? So let's review a little bit. Scientific independence of the FDA can be subverted in several ways. One is non-scientists can be making decisions about the drug approval process. This was seen very clearly with the judge in Texas invalidating the 20-year-old approval of misoprostone. It was overturned by the Supreme Court, at least temporarily. But the point being, you've got folks that are not trained in regulatory science making decisions about a drug. Now, there's other issues with that drug, I understand, but the point is who should be making those decisions about whether a drug is safe and effective for its labeled indication. Another way the FDA can be subverted is when drugs are made available or promoted without adequate scientific information. We all remember early in the COVID outbreak, the president supported the use of a couple of drugs that were not approved. But I want to be clear that this isn't about just the last administration. Personally, I'm quite concerned about states that are legalizing medicinal marijuana. I'm not talking about legalizing or decriminalizing marijuana. That's a separate issue, and of which I have some opinions, but it's not related to this week's update. What is important is when you say anything, whether it's marijuana or anything else, is good for a medicinal purpose, you have to ask the question, what drugs is it good for? What dose can you use? What type of marijuana can you use? What are the side effects? What are the complications? And so on. So there's a lot of questions that have to be answered before anything should be promoted for medicinal purposes. And then there's another way that the FDA can be subverted, and that is when the public loses confidence in a product that can actually save lives. And this is, we've seen clearly with vaccines. There's an anti-vax movement in this country being led by some well-known folks, and it's causing people not to vaccinate their kids. And we've already seen outbreaks of vaccine preventable diseases. So in all of those cases, the scientific process, the careful if slow, process of drug approval is getting subverted by non-regulatory folks. And so it's really important to understand that in any scientific process, but especially one around drug development, it's always complicated. There's always uncertainty and evolving data. And so at any given point, we have to have the confidence that the best minds have evaluated and analyzed the data were carefully collected, and that it continues to be collected after the drug is approved. Anything less than that, and we're going to lose confidence. Right. So if a drug is out there and you don't have confidence in it, you go to the doctor and she gives you a medication and you don't have confidence in it, we've lost a lot. So when FDA's scientific integrity is called into question, we don't know if a proposed product works. We don't know how much to take or when or how to take it. We don't know the side effects. We don't know if it interacts with other drugs. We don't know if it's safe in pregnancy. We don't know if it's produced in an appropriate facility. Ultimately, if you don't have something like the FDA, you will not know until after the fact if a drug is unsafe or ineffective. Basically, what we call bodies in the street. You won't know whether a drug is safe or effective until it's too late. At the same time, unfortunately, you may be led to believe that a product isn't safe and effective when ultimately it is. And so we will then return to the era of the snake oil salesman and patent medicine, when people could basically promote anything for any purpose. And the one in the middle on the top there, elixir of sulfanilamide, was associated with over 100 deaths in this country. So why should we worry about the threats to the scientific independence of the FDA? Because our lives depend on it. We have to trust the scientists to engage in an appropriate scientific process. Please feel free to share this video or any of the previous ones with anyone who might be interested. If anyone wants to be added to our mailing list, please let us know. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And if you have any questions about what I've said this week or any other evolving public health issue, please let me know. I look forward to hearing from you. So until next week, please be well.